Hey, everybody. We have a big group today. It's time for The Doctor is In. I'm so
Good
excited
evening.
today. We have a great topic. Hey, Dr. Mo.
Hey, good evening, everybody. I'm Dr. Monique Gary. I am a breast surgical oncologist just outside of Philadelphia and co-host of The Doctors In with my lovely, lovely co-host over there looking like summertime, Ricky Fairley. How are you?
We don't have too many days left. I'm like, summer's over. How did September happen? I don't like it. I'm
But
not
we're
ready.
not sorry. We're not entirely sorry this year. I have to say that.
Oh, no, it's true. It's true. It's true. It's true. So, you guys, look at our screen. We got so many people today. We're going to talk about breast cancer and young women. And we have some amazing, badass breasties to talk about their stories and share with you. So I'm going to like just introduce everybody and then we'll get into everybody's story. So we have Ariana, and I'm just going to say first name, Jasmine, Barbara, and Marissa, and Stacy. So let me just give you the fact of the day. All right. So the fact of the day is breast, black women under the age of 35 get breast cancer at twice the rate and die at 3 times the rate. Crazy, right? We know that overall we have a 42% higher rate. So these women are beating the odds, right? We have one story that we'll share with you that we didn't, but it's really amazing, how this disease is affecting us and affecting our young women. We're getting triple negative in high numbers. That's the disease I had. And we're getting diagnosed at later stages. We're not being taken seriously by our doctors. And a lot of bad things are happening that are causing those numbers. So we really need to figure out how to not make that happen anymore. And these amazing women are going to share their stories with you. So do you want to give any comments before we start, Dr. Mo?
You know what? I guess I want to say this. Um, the majority, 80% of young Black women actually find their own breast cancers. They feel a lump. They have some abnormality because, when we talk about imaging, the screening guidelines for breast cancer for average risk, for women at average risk, begins at age 40. So that already puts them in a category of you're too young for screening. We
Right.
know that we are severely lacking in terms of asking
Right.
for the detailed family history from our patients. And so when we talk about the risk factors and the unique risk factors for breast cancer, many times young Black women are left out of those conversations about risk, or they're just not held with them. We know that younger women in general have more dense breast tissue, and that breast density, or the stuff on the mammogram that shows up white as cancers do, the more white stuff you have, it's like static on a console TV. And some of you might be too young to remember console TVs, but I remember my grandmother's TV. And then I remember when that TV broke, she put another one on top of it. But console TVs were right; they were sort of analog-ish, and they relied upon they relied upon the screen to clear up the static. And so the density in the breast is represented by the static on the TV screen. And this is how I explain to women what breast density means. So the more static you have on your TV screen, the harder it is to see the picture. Is it Sally Jesse Raphael? Is it People's Court? Is it Murder, She Wrote? Who knows what picture it is, because you got too much snow on the screen, right? So younger women in general have more breast density, which is why mammograms are not the most sensitive tool for them. Black women in general have more dense breast tissue, which is also why the sensitivity of mammograms for Black women can be limited as well. So it's a double whammy. And so we want to talk about some of these factors. We want to hear the stories, and we want everybody to walk away with an idea of what they should be looking for in a self breast exam and why it's still important, because there are some societies that aren't recommending the self breast examination anymore. We want people to know how to advocate for themselves as far as getting the imaging that they need. And we want to impress upon people the need to know their family history, know your risk factors.
Know your her story. Know your her
know
story.
your her story, and
know you're normal. Know you're
Yep.
normal. Know you're normal. Like I tell people, start checking your breast when you go through puberty. Know you're normal.
Mhm. And this is why we have this approach, Ricky, where we're going to start younger and younger, educating young women about their breasts and about breast health before breast health becomes breast disease. So I'm just going to stop there, and I'm going to let everybody do round robin and talk about, introduce themselves and their organizations, and then tell their stories, and we're just going to get into it.
Yep, great. So I think Stacey's going to go first. It looks like we lost Ariana. Hopefully she'll be back.
So thank you, Ricky, for having me, and Dr. Mo. Such a pleasure to meet you, and so wonderful to be with all these beautiful brown women today, especially in a professional setting, which for me, representing Young Survival Coalition, I'm often finding myself in these environments where I'm advocating for young adults impacted by breast cancer, and I look to the left and the right, and very few people look like me. So this is indeed an honor and a pleasure. So I'm Stacey Lewis. I am happy to consider myself with the badass breasties. I'm just loving it. And I'll call myself a badass breastie supporter. I have been a staff person at Young Survival Coalition for 15 years now. And a main part of my focus has really been making sure that the organization is not only driving the message of the uniquenesses amongst the population of young adults impacted by breast cancer, but making sure that the diversity and the complexity around the health equities is amplified and elevated, both organizationally, making sure we're bringing women of color, women dealing with triple negative, women that are young moms together, as well as making sure that we amplify that voice and these unique needs of young adults dealing with this disease to researchers, to pharmacy companies, to those that are really the movers and shakers, the legislators looking to make a difference. And so it's my honor to be here, certainly representing Young Survival Coalition and representing sisters in nonprofit that are really in the trenches trying to make a difference. So thank you again for having me.
Thanks, Stace. Thanks, Stace. Marissa.
Hello, everyone. My name is Marissa Thomas. I am one of the co-founders of For the Breast of Us, which I know a lot of you know. We are the first online community for women of color who have been affected by breast cancer. I myself was diagnosed at the age of 35, about a couple of months before my 36th birthday, with stage 2 DCIS breast cancer. My cancer was about 35% ER positive, which is rare. So they treated me as I was triple negative, did the whole gamut of chemo, radiation, and I had 2 reconstruction surgeries. One of the things that Jasmine and I are doing with For the Breast of Us, of course, is bringing women of color together to definitely share their stories, to inspire each other, and also just develop a community where it's a safe place for women to be able to share whatever they're feeling, ask any type of questions that they have, and host, monthly podcasts, kind of the same thing what you guys are doing here every week, where we have different topics and women can talk anything about surgeries that they've had, from dating, anything, the whole gamut. I am happy to be here with everybody else, and yeah, just to talk about what it's like to be a young breast cancer survivor.
Awesome. Jasmine.
Hello, ladies. My name is Jasmine Sowers. I am the other co-founder for The Breast of Us. I was diagnosed with breast cancer at 26, misdiagnosed at 25. I was one of those people that went in, I had concerns. I actually went to the hospital first because I noticed discharge from my nipple and my breast was really swollen, and I was turned away from the hospital. They said, well, it doesn't fit these characteristics, so go see your primary care doctor. My primary care doctor, despite knowing my family history, my grandmother is a 2-time breast cancer survivor. She's currently living with metastatic breast cancer. Despite knowing those things, she did the regular test, which is the mammogram and the ultrasound. I did not know that there were other screening methods. And so I assumed that all that could be done had been done. And they said, maybe it's an infection, sent me off with some antibiotics. I didn't take the antibiotics because I didn't have any other signs of infection. I didn't have fever, I wasn't warm or any of those things, but I knew something was wrong. In my mind, I figured if cancer was the worst thing and they're saying it's not cancer, then we just kind of move on and maybe it'll clear up on its own. About 6 or 7 months down the line, I was going in to talk about starting a family. And by this time, the discharge went from yellow to more of a red. And I went to my OBGYN and I said, I'm ready to talk about kids, but we got to check this out. And And thank God that she took it seriously. She sent me to a breast surgeon, and the breast surgeon, we did a different kind of different kind of mammogram, another ultrasound. But ultimately, what discovered my cancer was a breast MRI, which I didn't even know was an option. So I was diagnosed. It was a little difficult. I was diagnosed with stage 1, but I had multiple tumors across 9 centimeters of breast tissue. So I went ahead and I opted to do a bilateral mastectomy. I did proton therapy radiation, and because I was hormone receptive, I decided, and I had no lymph node invasion, I decided to just do hormone therapy, and I skipped chemotherapy. As a co-founder for The Breast of Us, it has been an absolute pleasure to create this space for women of color and bringing together like harnessing the power, the collective power of marginalized voices, Latino women, Asian women, and getting them all in one place where they all feel empowered and they're able to learn from each other. When we started For the Breast of Us, it was based on, a lot of it was based on the research that African-American women are facing these certain barriers, poor communication, medical mistrust. And so we really kind of built our framework around how can we help women overcome those barriers. So it's a pleasure to be here with the rest of you baddies. I'm so excited to be here with you guys tonight.
So great. You guys give such good hugs and such good sisterly love to breasty love to our community. So appreciate you. Okay, Ari.
Okay, well, I don't have a story like the rest of y'all because I'm still young trying to form my career, but my name is Ariana. I go by Ari. I was diagnosed at 19. I was diagnosed 10 days before my 20th birthday. I found out that I was IDC and I was triple negative. My family does have the BRCA gene mutation on my dad's side, and it runs pretty heavily. My great-grandma had breast cancer. My grandma and my grandma's sisters both passed away from ovarian cancer. And my grandpa also had colon cancer. So I have I feel all the lines on the paperwork that says what family members have cancer. And unfortunately, we did a genetic mutation test, and one of my gene mutations came back inconclusive. So they had to retest me and come to find out I have another gene mutation called TP53. So everyone has that gene in their body. It's a gene that suppresses tumor cells, but my body does the complete opposite. So the combination of those two gene mutations is why they think I was diagnosed at such a young age. I went through 16 rounds of chemo, AC and Taxol, and then I got a double mastectomy. I had the spacers and I got implants because I'm too young to not have anything. And yeah, then I was in remission by September of 2019, but unfortunately my cancer came back in May and it was stage 2 again. So the first time was stage 2. I stumbled upon it by just simply shaving my armpits in the shower. It was like where your boob and your armpit meet, like your telespins. And it felt really hard. It felt like a rock because nobody ever describes to you what a lump is supposed to feel like. And so I was like, wow, this is really hard. I went in and I saw my PCP and she did my breast exam. And I thank her every time I see her that she took it serious because I'm such a young person. And I know usually young women do have dense breast tissue. So she could have just been like, oh, it's fibroadenoma or it's just a cyst or something. But she sent me in to go get a biopsy, and like a week and a half later, I found out that I was stage 2. And so it was pretty much the same thing for this second go around. I went in and I saw her again and I was like, yeah, it feels like a rock again. And so, yeah, I was re-diagnosed and now I'm going through 6 rounds of chemo and I'm gonna have to get radiation later on in the year, but radiation's not totally ideal for me because I have that TP53 gene mutation, because radiation could possibly cause me to get another cancer. But my faith in God is really strong, and I know that this is going to be my last time dealing with something like this. And I give back to the community by I'm going to school to be a radiation therapist myself. This was already my major before I was diagnosed, so I think it was a silver lining. And honestly, I have talked to a lot of patients that were grumpy, unhappy, ungrateful for their lives, was in a victim mode mindset. And I told them that I was a survivor. I just had a double mastectomy, reconstruction, and it's completely changed a lot of people's attitudes. about their treatment, and they become more positive. They're like, oh, if she could do it, I could do it. You know, I'm a full-time student in college. I work part-time and I still do it all. And I feel like that's one of my biggest messages too. Even realizing that with Chadwick's death, like just because you have cancer doesn't mean you can't do anything, you know, and
Right.
still conquer the world.
You're
You rock.
incredible.
You rock. You rock.
Walking miracle.
And Barbara,
Hi, thank you, Ricky and Dr. Mo, for just having me. I'm Barbara Norris, and I want to make 2 quick points. Dr. Mo made 2 really good statements. Most young women do find their own lump, and most of us do not know our family genetic history. And because I was divorced, I really didn't know anything about my ex-husband's family, because that is where the cancer started. But in 2015, in December, my daughter, Amber Norris, told me that she had found a lump. And we just shook it off as a cyst, told her not to worry, but she was gonna go ahead and get her appointment scheduled. And in February of 2016, it came back triple negative cancer. We had no idea what triple negative was. I never heard of it, never seen anybody. Then I started finding out about how deadly it was. But Amber took it really, really good. She's a survivor. She was a fighter. She started chemo. First, she had a double mastectomy. Then she started chemo. She wasn't really able to finish her complete chemo because she kept getting colitis. And it was really, really bad. But she continued to struggle. She did start on radiation. And in the spring of 2016, get it, this is a year later, it spread. It started at stage 3, and in the spring of 2016, it became stage 4. So we hunkered down. She was a true survivor. She did everything, just like the other young lady. She did not let that stop her. She drove to all of her appointments herself. And in the fall of 2016, she started slowing down. And in January of 2017 is when she went in the hospital, and pretty much she really wasn't able to do anything after that. Now, when Amber was diagnosed at 2015, she had just turned 26. So when her cancer really got bad, she actually passed away in January 2017, which was 3 days prior to her 29th birthday. So I just want to say that if you knew her, you would know that you could do anything possible, because she did. And during the time that I went through this, there really wasn't anybody that I could talk to. Somebody had cancer, knew about cancer, but I never met any moms who lost their daughter to triple negative. And I reached out, couldn't find anybody. And right after Amber passed, I got an email from the triple negative board, Ricky, in New York. And they sent me an email, and this lady was begging them to contact them so she could talk to somebody, a mom whose daughter had triple negative. And I kept reading the email. I read her email, and it just tore me up that this lady was begging for help. And ever since then, I started Amber's Moms to let people who have daughters that have had triple negative or who have passed away know that there is somebody that you can talk to, somebody who's actually been in your shoes. And it hasn't been easy, because I've actually had around 7 or 8 young girls across the country. But I just want the people to know that somebody is here that's actually been in their shoes, and the smile on those moms' faces when they talk to me is priceless. So I just want to let you know, if you guys need anything in the future, please reach out to me.
thank you so much. Thank you so much. And Amber, my dog's barking. Amber really I kind of went through with her. She was really the first kind of patient that I went through this with as an advocate. And she fought every day like a girl, every day like a girl, every day like a girl. So we have some great stories. We have some great work being done here by all of these badass forces of nature. And Dr. Mo, you have any questions for these ladies? I'm kind of speechless right now.
You know, I'm a little bit I'm a little overwhelmed by the strength and the stories. My good friend Ayana Moncrief just passed away last week from breast cancer, 38 years old, and you know, she and I had made several plans and trips we were going to take, and COVID got in the way of everything, and we were able to spend some good time as she was going through her treatment. And, you know, we talked to medical students here in the Philadelphia area about what they should know as young doctors when they see patients, you know, and how to do a breast exam, how to do a good history and physical. And you know, I guess I want to start, and before we talk about your organizations and the work that you do, you know, I wonder if you can talk to people in the healthcare profession a little bit and talk some about, you know, the type of relationship that you would have liked to have and things that you wish that you had known and things that we should be learning and advocating for ourselves as young women when we go to our PCP and our gynecologist offices. What are some of those things, some advice and some tips? We can just go in order of the screen, or anybody can chime in.
I mean, yes, I would say that first and foremost, we should definitely just be getting our routine treatments. It starts there, right? Not a lot of people actually go in, and especially with COVID being out right now, a lot of people aren't doing their routine checkups as they should be, which I get that there's a fear there, but we at least need to be doing our physicals, our mammograms, our colonoscopies if you're supposed to be getting those, going to the dermatologist and getting a skin check, going to the dentist. If you go to the dentist and you've got gum disease, like that can, you know, be a sign that something else is going on in your body. So just starting there and not necessarily putting the ownership on the patient or the advocate, but we do have to start somewhere ourselves. And then from that point, we can start advocating more for ourselves with if your medical providers aren't doing what they need to be doing.
Right.
I would agree with that as well. Just saying that since I am going to school to be a radiation therapist, I'm in the doctors from Tuesday through Friday, and our patient load has gone down a lot due to COVID. So like, I just want to say, y'all keep checking yourselves and doing everything. And also, I have only ever treated 3 Black patients, and I've been in clinic since like last year, end of 2019. And I've only seen 3 Black patients, and that's letting me know that my people aren't going out there and getting checked and taking it serious. Like, it's sad to see those type of things. And also, I feel like they need to bring back those little cards. I know y'all remember them little things that hang off the shower, the shower head, and it showed the breast exam. That's literally how I knew about a breast exam, because I saw that as a little girl, and I was like, why is she rubbing? Yeah, like the motions and the arrows and everything. And I feel like that's what helped me out. And I was just really informed because of my family history of breast cancer. So
who gave you that? Who gave you that, Ari? Who put that in your shower?
My grandma.
Your grandma.
God bless grandma.
Yeah, she
My
had
grandma
it
had
in
breast
every
cancer
shower.
twice, and I learned so much of what I know now from watching my grandmother battle breast cancer. You know, watching my mother with ovarian cancer. My mother had ovarian cancer 29, and she died before 30. And I don't have a mutation that we know of yet. And I keep checking to see what's new, what's on the horizon, because is there something that could be out there that's just not on a panel that, you know, I just haven't been tested for yet. There are new genes every day. Any other advice? Because my next question is, has anyone ever talked to you about what a normal breast exam feels like? What your breast feels like?
I would also say something about Ari's story kind of struck me, especially for women that have already been diagnosed, to remain vigilant after your diagnosis, because there is this misconception that a bilateral mastectomy means that you cannot get breast cancer again. So remaining vigilant is very important. And as you're going through the process, never be afraid to ask questions or to get a second opinion. And if your doctor is not answering your questions, don't be afraid to seek someone else. Because I definitely had to let some doctors go. It probably took me about 3 or 4 oncologists just to get a doctor that was willing to explain the impact of the treatment on my fertility. Like, I think sometimes doctors, they have a very short-sighted view. It's about treating the disease and they forget to treat the person. And so I had to continue to advocate for myself, remember the life that I wanted beyond the cancer diagnosis.
That was my next question, was did anybody discuss your fertility options with you?
I forced that conversation, but I will say that I remember having one of the first oncologists literally said, let's worry about the cancer for right now. And I'm like, but if we treat this the wrong way, we may not have a later to talk about this.
Your story
I
is
would
really
certainly add,
interesting.
yeah, as you know, as representing an organization that has been in existence for 20 plus years, right? At the founding of the organization, this was one of the primary issues that doctors were not even thinking to have the conversation with young women about their fertility as they approach treatment. And there was so much unknown because young women still are not really studied as a population. So they're taking treatments that have been well studied in clinical trials, but well studied in the traditional postmenopausal breast cancer population, and applying that knowledge to women in their 20s and 30s, and not even having the conversation. And we've been advocating at levels, not only legislatively, but with NCCN, those that kind of set the guidelines for doctors, right, to say, approach this way. Don't forget to have that important conversation. And Jasmine, I think that your demonstration of self-advocating is so important, because
Yes.
there are still many in our communities that don't feel empowered to talk to doctors. So I think, Dr. Mo, part of your question was about how can we encourage or inform even the medical community, right? And I think the primary informer there is listen. You know, listen to your patients. At least two of these young sisters said that they were either misdiagnosed or told they were too young or don't worry about it. But, you know, doctors need to listen and then treat the person, not the patient, right? So the person is diagnosed in their 20s or their 30s. Those persons need that conversation about fertility, about what are your life goals? Will this treatment impact those life goals? So I just wanted to really amplify that point, because it is a partnership between the provider and the patient. And I think that they both have very important roles to play in the most successful health outcomes.
I love that you said that. And Ari, I want to let you get in here too, because you were going to say something, and I want to circle back to that about how we treat young women with breast cancer and what the guidelines say.
Yeah.
Well, they didn't really touch so much on my fertility. They told me that it would just come back because I'm young.
Really?
Yeah, they didn't really. But I mean, I really trust my oncologist. I don't feel like she overlooks or underlooks anything. She's a Black woman herself. So my whole breast cancer team is all women and minorities. So I'm like all for it. But I was going to say, for Jasmine's story, I think that's really interesting that you were misdiagnosed. And if there's anyone on here that is in health professions and you're Black, I would just say keep going and keep striving, because we need more people in our field. We need more people to listen to us and take us serious, because there's too many Black women dying in hospitals and being mistreated.
You're absolutely right. And I have to tell you, since COVID started, I'm seeing much more what we call locally advanced disease. So things not detected on routine imaging, but things that are in the lymph nodes, you know, nipple changes, skin changes, things that would indicate stuff is maybe a little bit further along. And it's because COVID has disrupted a lot of how we screen. And on the topic of age, you know, there aren't a whole lot of guidelines for the youngest patient I've seen with breast cancer is not a patient of mine, but a good friend of mine who's 17, you know, and there are no guidelines for how we treat, you know, people in their teens, and, you know, with breast cancer in terms of things that have been studied over time. And so what ends up happening is that we end up throwing everything at these young patients. They get the most toxicity. They get all the chemo, all the radiation, all the everything, because they expect you to live long and they want to hit it hard so that it doesn't come back. But the toxicities that are associated with that can have really lasting side effects as well. heart issues, issues with neuropathy, issues with fertility, issues with alopecia, with hair loss, with, so many things, memory, with estrogen blockade and bone density, right? Ricky, we're going to talk about bone density at some point, but there's so much that needs to be tailored to the unique physiology and unique needs of young people. And we need more trials that look at these things, because many of the trials exclude patients of a certain age. They exclude patients with certain comorbidities. And we talk about this on this show quite a bit, because the trials are designed for the ideal sick patients who are just sick enough, but not too sick, just in that age range, but not too old and not too young. And we need to begin to look at the margins, because the margins are getting bigger and bigger and bigger. And this is a much more mainstream issue than just on the fringes. We're dying from this.
Yep. And Doc, Ari brought this up before we went on air about even some of the stuff that she was dealing with as a young woman was losing her hair and, and getting a mastectomy. And you guys talk about that a lot too, Jazz and Marissa, that you're young, you want to date, you want to have a life. And I know Amber dealt with the same thing in terms of like your self-image, your self-persona, who are you, and how it's affecting your psyche, right? So I think that's another big part of it, and treating that, giving you what you need to deal with all of those emotional issues that you're dealing with. So we need all of this to be dealt with by our medical community. But Dr. Mo, we talk about it all the time. I would never fire you because I love you, but sometimes you have to fire your doctor. And it's okay. I mean,
it's real talk. Sometimes you do, because if they're only telling you, number one, that there's only one way to do something. And I had a great interview day with breastcancer.org, and we talked a lot about breast reconstruction, and she was asking for advice on that. And I'm going to get to you guys and ask you some advice for those who've had mastectomies and reconstruction. But helping young women especially to understand what their options are. And if somebody says, well, this is the only thing that we can do, or because you'll need radiation, I can't do this, or if you want breast conservation, it may not be possible. They need to tell you why. They need to explain to you what your options are, what is the art, what is the science, and they need to begin to start showing you pictures of patients who look like you, pictures of patients who have had radiation, and that you can operate on post-radiated skin, that you care about scars and where they go, because scars are not just disfiguring, but they also can be uncomfortable. They can cause chronic pain. There's a lot of stuff that we need to talk about with patients that's more than just getting rid of the cancer.
Right.
And like that's the minimum, but there are so many quality of life and survivorship issues and sexual dysfunction. Can we talk about having a dry vagina, and I'm going to put you on this pill and it's going to cause your libido to do what, right? And it's unbelievable the amount of information that can be lacking sometimes in those relationships. And so, sometimes you do have to research your doctors carefully.
Yeah.
I would also say not be afraid to have doctors at different medical centers. I think we're all used to just going to one medical center and having all of your care streamlined there, where you could have your breast surgeon over at one medical center, but then your oncologist could be at the cancer center, and they can still work together, just even if they were under the same roof. Right. So I think we need to be able to be open to know that your healthcare doesn't need to be centralized. You can decentralize it and go to somebody that you have a good relationship and a good rapport with, who is going to treat you well when it comes to your healthcare journey.
Yeah, that's a really good point. That's a really good point, Marissa. We don't shop off the same store,
Right.
But find who's the best at what for you,
Exactly. And it actually took me a while to get to that point, because I did see the convenience in having all of my doctors in one place and in one app. And then I got to the point where I was like, I just want the best. So where do I go to get the best? And then, so a hot pursuit off of what you said a little earlier, Ricky, is, in my opinion, I feel like mental health should be just as important as the oncology piece. And I think that is a big missing piece in a lot of oncology treatment, because it changes your whole life, and it changes your body, and you deal with body image, and you deal with issues in your relationships. And, a lot of women, we've talked about how, you get to the end of treatment, and that's when you really start to feel it. And then that's when you lose the most support. Like, your safety net is gone. People don't think you need them. There's no guide on how you live your life after, or when the active treatment stops. And so I think a huge gap is the mental health component. And just speaking to a little bit what Marissa said earlier as well, I mean, the importance of asking questions, but now we get back to the importance of having community. And that's where we feel like for the Breast of Us and YSC has been really awesome, because it was in a hot tub at the YSC conference that I realized I wasn't the only one that was having these issues with sex. And other girls were saying, this is what I've tried. And then I'm like, oh my gosh, well, now I have somebody that I can talk to. There's an actual doctor that focuses just on women's health. I didn't know that. So community also plays a really big part in survivorship as well.
Right, right.
I really like that you said the mental health aspect. I actually had to write a paper this summer over anything over cancer. And my paper was over how mental health can affect the quality of life of cancer survivors after treatment. So I feel like no one ever thinks about the women that are like done, because your life is completely changed. And I feel like I had that feeling as well, as like that abandonment feeling. It's not like I wanted to continue to be sick, but it was like, had all these people loving on me, taking care of me. And then once you're done, they're like, peace. Like, I'm still kind of like broken after treatment, you know, like I still need tons of support. With my research, it says that like people that are survivors for 1 to 2 years is when they have like the most problems. Like, you're trying to get your life back on track and trying to get normalcy. So I really care about the mental health aspect. And I actually want to pass out cognitive therapy worksheets to some of my patients, but I have to get approved first by the lady that runs the office. But I want to work with it, because cognitive therapy is the focus on negative thoughts and negative words and their consequences. And in my research, it shows that the survivors that were constantly being negative and stuff after treatment, they continue to have some other physical problems. And eventually, some of them got mental illnesses. So I really like to focus on the mental health aspect of all of this, because your mental and your physical are literally tied. They're one.
I love this. We always get questions about nutrition, about mental health, about meditation and spirituality. And I wonder if you guys can speak to some of those things and talk about the power of how those have been transforming your survivorship journey. So nutrition, mental health, meditation, prayer, yoga, whatever it is that you do, those practices that keep you balanced.
And you know, Barbara's probably dealing with a lot of these things too as a mom, and that you're talking to, you know, just
maybe talk about that a little bit too before we get to my question. Let's talk about the mental health of a mom and a caregiver and a supporter, you know, who's watching and witnessing this. And then what do you then do afterwards, and how do you turn this into something that's transformational for so many people, as you have already?
Yeah,
it's very hard. You have to really have faith, because that's actually what's kept me through the whole process. And during the 2 years that Amber had cancer, it was just her and I, 24/7. It was just her and I only. And it was the greatest 2 years of my life, because we were like twisted, we were tied together. And just to see her face, to know that she actually said, Mom, you're Superwoman. I know you're Superwoman now. And now looking back, to know that she loved me unconditionally, because when they start losing their function and ability to do things, you're there. And that's what inspires me, to know that she saw that and she thanked me a million times. That's what really gets me through. But one of the things that gets me through is I had a mom tell me, after she was talking to me, and I was just talking, being myself, jolly, you know, and her daughter was sick. And she said, I know I'm going to be all right. And I said, well, how do you know that? She said, because I'm talking to you and I'm listening to you. And I never knew that just my positive voice structure, she said, I'm going to be all right. And I was like, she's listening to everything I say, but just the positivity in my voice just made her know that she was going to be all right. And the one thing, you know, you promise your kids that you're going to be all right. And that was the one thing that Amber made me promise. Mom, I'm worried about you. Don't worry, Amber, I'll be all right. It wasn't the easiest thing. It's the hardest thing I've ever done in my life, but I get reward by knowing that I can help just one other person go through this. And that's what I'm living for, just to help one other person go through the most tragic part of their entire life.
You go, girl. I love you,
Well,
Barbara.
Barbara,
You got me teary-eyed.
I will be reaching out. I mean, I think that this is such an important component of the conversation because it is likely that for anyone that has been through something extremely devastating like a breast cancer diagnosis, that there's someone, at least one person that walked through hell with this survivor.
Yeah.
And, you know, for us as an organization, we realize that what we call the co-survivors, only because a lot of younger people don't necessarily want to refer to as a caregiver, you know, for their spouse or for their sister or for even for their daughter. But it's such an important community, and it's important that we support them and give them permission, the moms, the spouses, to take care of themselves and to, you know, get the mental support, the physical support that they need as co-survivors. You're so important. And Barbara, I will definitely reach out to you because I do think we have a co-survivors group on Facebook and a moms group that meets monthly. And they are just that, mothers that are really just there supporting each other, men that are really there supporting each other because they need that, even though they haven't been specifically diagnosed. I think that that's so critical, and it dovetails with our kind of community issue, a societal issue around mental health. And I think that we have to keep having these conversations about mental health and about the experiences that we go through and the value of addressing the mental health fallout from those experiences.
Yeah, it's real. It's definitely real. We have a question in the chat where somebody put something, they're feeling a lump and feeling a discharge. You need to go to the doctor, sweetie.
Yes,
Please. Please go to the doctor and check it out. Don't worry,
Absolutely.
not
be afraid.
Not like $200. Go to the doctor.
And reach out if you need the name of a doctor to go to in your city.
you know,
Just tell me what city you're in. I'll find you one.
Find you one. Yeah, no, you need to go to the doctor, check it out. Don't take any chances. And no
And I
one.
think I will say, oh, sorry, Ricky.
Go ahead, babe, Marissa. Go ahead.
I think what I will say, even to Stacy's point, is the one thing that I've always said is that even though your friends and family weren't physically diagnosed, they were still diagnosed in a different way. And so making sure that they have that type of support. And one word that I heard this week was care partners, which I loved as well.
That's
And
great.
also with kids, like when I was going through treatment, my son was 13, and I was making sure that he was in some type of therapy because they have their own issues that they have to deal with, right, too? Like if they're watching their parents go through treatment, everything that's going in their mind, like what's going to happen to my mom? Is she still going to be here? Or, you know, how is she going to survive? What do I need to do to help? So they also need some type of care as well.
Oh, yes, absolutely.
Love care partners. I love that. But you guys are like such rock stars. Such great rock stars, but it's such a big thing in our community. And you know, I think we have to really figure out how we can help young women know their bodies. Like, so we actually are working on, at Touch, we're working on a program at some HBCUs. We're going to have a show about it in a month or so and talk to some, you know, kids on campus and really get them talking about it. Because I think when you go through puberty, you should start checking your breath. And I mean, you know, like, you know, now, and we actually went.
What HBCUs you going to, State?
We'll talk later. You can help me out.
Okay.
I went to FAMU, so we got to go to Florida A&M. I'm a Rattler, so we definitely going there. You know, we got to hit up HU and those Bisons. You know, we got to hit Hampton. You know, we got to hit them all. Honestly.
So we're really going to basically get interns on like 6 campuses, so we can talk about it. But it'll be all over the country because we're going to be online. You know, we'll be online, so anybody can join it. But we're putting together a toolkit so they can post on their campuses during the month of October, and then we'll bring them on the show on November 14th, and they can talk about what they learned and talk about what they posted and what kind of impact they made on their campus. But the whole thing is about checking your breath, knowing your body, knowing your normal, and knowing your her story, and having those conversations with your mom, your grandma, your aunt. Trying to find that out and figure out what's going on in your family that could impact you. And, you know, we know most breast cancer isn't hereditary, but if it is hereditary, you should know about it and be able to act on it, right? And talk about it. And, you know, there was some data that came out a couple years ago that 92% of Black women are aware of breast cancer. 27% talk about it, but only 17% act on it. So we're not talking about it at the kitchen table. And we should be talking about, like you're talking about buying shoes, like you're talking about going to the dentist. Like it should be something that's in our family vocabulary that we talk about all the time. And it's really important. So we're hoping that we can make an impact with these college students like you, Ari. And, you know, I'm putting you to work, girl.
Mhm.
I'll tell you
I
tomorrow.
like work.
All right. And really kind of help us spread the buzz, because you know what you can help us with too, and it's like, how do we talk to young people? How do we talk to young women? What do we put on the meme that they can put on their Instagram page? What kind of TikTok dance can we do to get them cancer, right? Because it's a hard topic when you're young. You don't want to know about it. You don't want to hear about it, but it's real and it's happening, and we have to stop it. We have to stop it. We have to stop it. And you know, we can, you know, early detection is our only protection. So we have to get people in that mindset, knowing how to check their breasts and knowing when something is not right, raise your hand and talk to a doctor. And if they don't listen to you, find another one.
Right.
I love it. I wish I could get you guys. And you know what? I may actually invite you to do this, but I give lectures to the medical students at 2 medical schools. I'm on faculty, and I would love to have all of you come and talk to them, because just as it's important for me to be in this space and to talk about, you know, things like, well, what are hormone receptors, and, you know, what did normal breasts even feel like, and how do we talk to your doctor? What questions should you ask your doctor? I think that it's equally important for you to inform future physicians, future PAs, nurse practitioners, et cetera, nursing students on, you know, on the flip side of this relationship, and inform the questions and the thoughts and the dialogue that needs to happen there, because it is such a trust relationship, you know. By the time you are diagnosed with cancer, God, I hope you have somebody that you have already established care and trust with, a PCP, a gynecologist, someone who can help you to chart these waters and begin to unpack all of this stuff. Because when you're diagnosed, it's, you know, you're already a deer in headlights. And then you got to figure out who I'm going to trust. Then you got to figure out, how am I going to pay for it? How am I going to get there? How do I navigate? What are the questions? Is this the right person? And it's so much, you know, and I want to,
you know, Dr. Mo, you know, and Ariana, help back me up on this if you would. You know, you guys are going to find birth control, right? Where are you going? We're going to get the birth control, right? So, so whoever you're talking to about birth control can help you with breast health, right?
Well, you hope, you know, and I've got a lot of referrals from Planned Parenthood, and there's some issues that we're not getting into today, because that's beyond the scope of this conversation. But services need to be available. Yes.
Right.
Yeah, the lady that I actually go and get my birth control from, she was the one that did my breast exam and sent me to go get my biopsy and everything. So that's the lady I trusted. And I also wanted to talk about the cost thing. I don't know how it is in every state, but I know some states, they have some form of Medicaid for people that have cancer. So I'm an independent student. My mom passed away when I was 16. And my dad lived all the way up in New York, and I'm here in Texas. So I was on Medicaid, like kids Medicaid, up until I was 19. And when I got diagnosed, I had no insurance. So I was worried about the same thing. But in Texas, actually, if you get diagnosed with breast cancer, cervical cancer, I can't remember the other one, you get like full coverage Medicaid. So like my treatment, my surgeries, everything is all covered. I never gave a dime to like my treatment. Mostly like when I get donations and stuff to like my GoFundMe, it goes towards my bills, because like I said, I'm an independent student, so I pay all my own bills, and I got a car note, and I got rent and groceries and gas and all those other things like that.
Yeah, life is really real, right? On top of cancer.
Yeah. Proud of you, girl. So proud of you. Did your mom have breast cancer?
No, she didn't. But I think when she passed away, right before she passed away, she was diagnosed with leukemia.
Okay, so some form of
but that's not like 100%, but she didn't pass away from cancer.
Okay.
Now, I guess that's a question that I wanted to ask you, Dr. Mo. How many, do you know the numbers on how many women of color in particular, that actually get genetic testing?
So percentages that are offered genetic testing are low, and there's different numbers in different studies, but I'm going to say probably something like 60%, or even lower than that, somewhere between 40 to 60% historically. And that number in the last 5 years has gone through the roof because genetics has become a really hot topic in breast cancer. And so there's a lot more research being done and a lot more genes have been discovered, and the panels are no longer just the BRCA1 and 2, but now we know there's P53, we know there's the FANCA genes, we know there's P10 and all those others. So historically, probably like 40 to 50%, maybe 60 at best. But in the last several years, more and more. And the reasons why: 1, doctors were not offering it; 2, insurance companies were not covering it; 3, it was still very much on the fringes of how it changed management. So meaning if you had a mutation, that can change your surgical management because you have a 60% chance of getting another breast cancer, a second breast cancer in your lifetime, maybe an 80% risk of something else, so it changes the management. And many surgeons were not open to that at the time. They see a problem, they want to fix that problem. And then we'll deal with whatever else down the line. Now we take a really sort of stepwise approach to it where I want to know everything you're at risk for, everything you may need a surgery for, every conversation that we need to start having, let's start it here. And so that testing's done on the front end. But you're absolutely right. That testing, I can't tell you the number of Black women that I see who were diagnosed in their 30s and their 40s and their 20s. And now they're in their 50s and their 60s. And they say, well, I never got offered that.
Right. I learned yesterday, I was on a patient power panel, and I learned yesterday that if you have TNBC and have BRCA, you actually respond better to chemo. Than if you don't. I had never heard that before. And I do a lot of TNBC research and stuff, but that was new news to me that you actually respond better if you have BRCA with TNBC. So that's good news.
The really good news is that if you meet that criteria, if you're watching and maybe you're postmenopausal and you were diagnosed in your 30s and no one ever offered it to you, you can go to your gynecologist now. You can go to your PCP. Shoot, you can go to my website and you can get genetic testing. You can get hereditary cancer testing now that is either reduced rate or that is covered completely by your insurance. And so even if you didn't get it then, you still meet criteria for it now, and it can be important information for your family. And part of that conversation, I thank God my Aunt Geraldine, my Aunt Jerry's watching. She texts me because she texts me happy birthday. Thank you, Aunt Jerry. And I said, I'm on the show. I can't talk right now, but she's watching, and she's one of the people who told me what my mother died from, because I didn't even know. And ovarian cancer is less than 1% of the population. And it's conversations that we're not having in our families. A couple of things. We don't talk about money. We don't talk about our health. And those are 2 things that we have got to have conversations about at our kitchen tables and in our households, and teaching our kids, just like you're teaching to brush your teeth, teaching them how to do I have a hashtag, check your chest, right? For young men, check your chest, check your boys, check your girls, check your breasts, right? We got to be talking about these with our kids.
Even your A1C, your blood pressure, like all of those things, I like harass my family all the time. Like, okay, what's your blood pressure? How's your blood pressure? It's like, so we got to talk about it. We got to put it on the table, because there's no reason not to. There's no reason not to. We have to take care of ourselves. So we do. And also going back to the
think that
Go ahead.
I'm sorry. Go ahead.
No, go ahead.
I was just going to say to Marissa's question around the percentage of testing. I also think it's the value of, and Jasmine and Marissa, are very much involved in learning more. And I think it is the value of becoming educated advocates, so that those norms can be challenged at the right level with the right information. And so it's going to be a beautiful thing to watch these young sisters really continue to press in and amplify the voice of young women and young women of color dealing with breast cancer, to say this percentage being genetically tested or having genomic testing is not acceptable.
Right. Yeah. I had genetic testing myself, actually 5 years before I was even diagnosed with breast cancer.
Okay.
And I do have a genetic mutation. I have Lynch syndrome. And I remember when I was diagnosed telling my doctors that you guys should probably research me, because I'm pretty sure that this probably is connected to the reason why I have breast cancer. And they all dismissed me at that point. And now there are studies coming out saying that they are connected. which it's just like, okay, so if we can get more women to get genetic testing, they can be proactive. Because I'm always proactive with my doctors, because I know all the testing that I have to have done every year. I have to have a colonoscopy. I have to have like my urine checked just to make sure there's nothing going on with my kidneys. Like there's all these things that I know that I have to do. And if my doctors aren't on top of it, that's where I'm just like, okay, hello, I need you to order this, because I have to get it done once a year. And just having that power and that knowledge to let them know that you're not playing and you know what needs to be done, that kind of lets the doctors know, okay, well, she's on top of her stuff, so I need to be on top of my stuff too, or she's going to call me to the carpet.
And circling back to that, because that's an excellent point. You know, I started the high risk program in my hospital when I got there 5 years ago, and they looked at me kind of funny. They said, well, you're a surgeon, you need to operate. What are you doing this for? And I said, because I got a mom who had ovarian cancer and a grandmother with breast cancer. What are you doing for people like me who need to know what their level of risk is, who need to know if they have mutations, so that we can catch them before they get cancer, so we can make sure they're getting the right screening. And so if you happen to be watching and you have a strong family history of breast, uterine, ovarian, melanoma, colon, pancreatic, prostate cancer, what else am I missing? Ovarian cancer, gastric, stomach cancers, all those things, you know, multiple cancers on one side of the family, you need to talk to your doctor about it. And if they kind of brush you off and say, oh, it's probably not hereditary, only 10% of all cancers are hereditary, which is true, that still doesn't mean that you shouldn't get enhanced screening. Right. And that's the point. You should get enhanced screening. So find you a high risk program. Find a program that specializes in high risk and that will get you the right screening, that will get insurance to cover things like MRIs, to cover things like colonoscopies before your age, before your normal screening age. And there are places that specialize in that. And if you're watching and you've got a family history, you should find out about those programs.
Yep. Yep. I think the other thing too, you know, I believe Black breast cancer is different. And I think there's so many things that we don't know, that we haven't identified yet. And, you know, my Dr. Regina says all the time, you know, well, Ricky, you don't have a genetic profile right now, but mutation right now, but, you know, you could. So we have to participate in research, and we have to get more of us in research so we can understand our physiology and understand Black breast cancer in a different way, because I know that there's so many things about our disease that isn't the same as white women. And, you know, my word for the week is mortality rate parity. So what does that mean? That means I don't want anybody to die of breast cancer. I want everybody to stay alive. But if we have to die, we should die at the same rate as white women. It shouldn't be different, right? So until we can sort of get there and understand that science, we have a lot of work to do, and encouraging each other to do the research, participate in trials. And, you know, that's why we also have another program, our Black Data Matters program, to get people signed up for Citizen, you know, our Citizen partnership to help them consolidate their and digitize their medical records so they can get teed up for trials. We have to do this work, you guys. We have to, you know, understand our science better to do better.
Talk to me about activism and how people who might be watching, because we're getting a number of viewers every week, and there are people who want to connect with you guys and who want to get involved and who need support and encouragement, but also who've gone through it and are looking to give something back and make some sense out of what's happened in their stories. Where can they connect with you, and what's next for your organizations? What's coming up that we can sponsor and support and amplify for you?
So for the Breast of Us, we're hoping to make a big wave October VCAM. Last year, we did the One Word project, where we encourage women of color to share their experiences in one word as a way to allow women the chance to share their story their own way. This year, we're focusing on we're talking body, basically, body image, how we feel about our bodies after breast cancer. And we will be intentionally showing what Black, brown, and yellow bodies look like after breast cancer, because it is so hard to find imagery of us online, which is ridiculous. So stay tuned for that. It's called the Naked Truth Project, and we're hoping that a lot of women are inspired by it.
I love that.
And then if people are interested in connecting with us, we're at breastofus.com. We're on Instagram and Facebook and Twitter. And we also have a Facebook group called Breast Cancer Baddies, where that's really where our community is kind of buzzing all the time. We share a lot of advocacy and research opportunities in that group, and women are always sharing tips and tricks on how to navigate their journey. So that's a great place, a space for people to connect with us, especially if they're interested in getting back involved.
Yeah. And so Ricky and Dr. Mo, if you know of any women of color who would like to participate in our Breast Cancer Awareness Month project, please send them our way. We can even send you a copy of what we're doing on social media, and you can share that on your social media as well, because we
share it.
definitely want to get a lot of pictures of women.
I love that. I love that campaign. It's going to be great. Very good, great.
And so
I don't have anything really to share, but you guys can follow me on Instagram. My Instagram name is Mama Ari, MOMMA_Ari with 2 I's.
I love it. Listen, I'm tempted to tell you,
And you
put the
could-
Cash App up there, you know, so we can support you.
Oh yeah, my GoFundMe is on my Instagram page. It's the link in my bio. I'm trying to hit my goal so that I can have all my financial burdens taken care of, because I don't need to be stressing at all throughout my treatment. So I still have, I still have 3 more to go, and I still have radiation at the end of the year. So yeah, I'm trying to get all of that wrapped up.
How much school do you have to go, Ari?
Oh, I graduate in May.
Oh, you graduate in May. All right. Yeah, all right.
Oh, congratulations.
You travel to
That'd be
Texas by
exciting.
then. You think you guys maybe can travel by then? That would be lovely. That would be lovely.
Yes, hopefully we'll.
Oh
be,
yeah,
we'll
if y'all
be-
can
we'll
come
all
out to
be
my
released to travel.
graduation.
Yeah. We'll have a party on the show for sure. Okay, we'll have a party on the
Let
show.
me know. I'll be there. I'll fly. I'll come down there. Absolutely. As long as it's safe.
Yeah, let's go.
Oh yeah, for sure.
Well, Dr. Mo, you and I are both in PA, so PA rocks. And anybody looking for anything from Young Survival Coalition can reach out to me. Stacey Lewis says in my little box. We're at youngsurvival.org. And so, Ricky, thank you again for having me, for having YSC, Dr. Mo. Such a pleasure to meet you. I'm right here in the Lehigh Valley holding it down, you know, for the suburbs of Philly.
We're neighbors. I
And,
practice in
all
Bucks
of you-
County. That's great.
See? So, and it's such a pleasure to spend this time with you all. So thank you again.
Thank
Thank you. I just
Yes,
want to
thank
say,
you for inviting me as well.
thank
It's
you,
crazy
guys.
meeting so many influential Black women out there in the world.
Thank you for sharing your stories. Thank
You're
you
a badass. You're a
for
badass.
inspiring us and for inspiring me, truly. You know, I want to circle back with all of you as we talk about survivorship, because it's this big black box. And I hear from patients over and over again. Like I keep track of my patients, and I still try to reach out after their treatment, and I still see them every 6 months for 5 years. But that relationship where you're seeing your doctor with that frequency, there's a gap there. And so we develop programs to try to address that gap, because you feel like, well, now what? Well, now who's checking? Well, now how do I know? How do I get back to my life? And that transition into what we call survivorship is something that we don't talk enough about. And I want to have you guys back to talk about that. Or I want to talk about your research too. And let's make some headway here as we get to things like sexual dysfunction and mental acuity. We got to talk about nutrition. Every week, somebody in this box is asking questions about nutrition and what your diets are like, and how we can incorporate exercise and Reiki and yoga and all these things, right? So we got to get to that stuff too.
And we have so many topics. We have like so many topics to talk about.
Yeah.
So Barbara, I love you, Barbara.
Yes, please.
How do we find you?
So if you want to find me, you can email me at bnorris12412@yahoo. Or you can just contact Ricky through the show on that page, because we're best. And she can reach out to me. But the easiest way is probably to contact Ricky through her programs.
Right.
And she'll get right to me.
I'll hook you up. So moms, if you need her, she's there for you. Yeah.
And daughters, if you need her. We got some
Amen.
folks who need some moms. They need some wisdom and some love, some hugs.
Yeah, we're here for you. So Ricky, RICKI at touchbbca.org. You guys know that. We're on, Facebook, Twitter, Instagram, YouTube, BBCA, Touch BBCA.
I'm Dr. Monique Gary on all social media channels, the LinkedIn, the Facebook, the Instagram, the Twitter, and apparently a YouTube station. and if you need me, you can reach me for consults, second opinions, through telemedicine now, for support, for research. But I'm here for us. I'm here for the sisters, for the breast of us, for the baddies, for Black breast cancer, because it's time. We are the ones we've been waiting for.
Absolutely.
Yeah, fierce forces of nature.
Absolutely.
Fierce forces of nature, you guys are.
Yeah,
So
we
thank
hope
you
that this
so
has
much.
relatable, reliable, and real. The doctor's in every Wednesday night at 6 p.m. on blackdoctor.org. So thank you guys again.
Thank you.
Yes,
you.
thank you.
Thank
Rusty
you.
love, everybody. Rusty love. Thank you. Bye.
Thank you, ma'am.
Bye.
Bye. Bye. Bye.